Parkinson's disease is on the rise. With the rapid acceleration of aging population, we've been observing an exponential growth in the number of people living with the chronic neurological disorders, to include neurodegenerative disorders, with Parkinson's disease being among the fastest growing neurological conditions.
Parkinson's rehabilitation program at Glen Cove Hospital, Northwell, was created 5 years ago as a lifeline for people with Parkinson's disease, moderately advanced Parkinson's disease, who felt broken by their illness and trapped at home with limited access to quality medical care. We wanted to find these patients and bring them to one rehabilitation hospital, where in one place we could give them all the care they need.
The mission of the Parkinson's Acute Inpatient Rehabilitation Program at the Glen Cove is to raise health, promote wellness, improve quality of life, restore function, and maximize independence. It's about regaining self-reliance and dignity.
The program that we have here at Glen Cove is specifically designed to address people who are in the mid stages or mid-advanced stages of the disease. So people who are starting to lose their independence, people who start losing their ability to walk, they start falling. It reaches a time when, with all the efforts, with all the medicines, with all the rehabilitation, even the best care you can possibly have as an outpatient, life becomes difficult. Their care support becomes difficult to coordinate. And this is when a program like this can help.
Every patient has a distinct treatment plan. Every patient has a wish list. We're determined to make them happen. Average program lasts 2 weeks, 5 days a week, up to 5 hours of therapy a day. What makes this program unique is the integrative, multidisciplinary care program that treats the whole person, utilizing the evidence-based practices in Parkinson's care. We offer advanced medical management and Parkinson's-specific restorative rehabilitation. We offer novel therapies like dance therapy, music therapy, and creative arts.
Dance for PD is a program that invites people living with Parkinson's to explore the joys and benefits of dance. Here at the Glen Cove Dance for PD program, we are working on a very wide range of skills, both motor skills related to balance, and amplitude, coordination, and rhythmic movements. But we're also trying to foster and cultivate a sense of creativity, a sense of social connection, and a sense of agency, so people feel that they can make choices about their movements and about how they want to express themselves through dance and through movement. They can then carry out as they continue their daily lives outside of the clinic.
At the beginning and the end of our program, every patient gets evaluated with at least 8 functional skills that assess mobility, self-care, transfers, quality of voice, perception of quality of life, just to name a few. The improvement we see are consistently higher than the industry standard. The secret recipe for success is the care model we developed and incredible people that make it happen.
There are stories that are really striking. During a half an hour visit to the office, there is that much you understand about a person and their lives. People have followed for years and years and years, and I thought I knew their life. We come here in this context and discover a lot of elements about their lives which make our ability to function in this world very unique. The ambition, the dreams, the elements of life that still needs to be achieved despite Parkinson. So that element unfolds, and really, to me, has been the most revealing part. When we started this program, I never thought that it truly, patient narrative, or patient lives would become so center stage in this setting. And part, of course, is this amazing team we have. People have come back to life, to be independent, to pursue whatever was left as dreams in their life, considering the age and the disease.
I'm excited about the future direction of Parkinson's acute inpatient rehabilitation program at the Glen Cove. I know we're going to continue to grow and expand and potentially integrate some of the newly emerged technologies in the care of our patients. I'm also excited about research opportunity and expanding our fellowship program in neurorehabilitation on improving the lives of people living with Parkinson's disease.
Thanks for watching this AAN TV feature. Now, an important disclaimer. Content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.